Hello, psychologically minded people. Today we're going to be talking about CBT, cognitive behavioral therapy. A lot of people have heard of cognitive behavioral therapy. They've had a psychology class or somebody's mentioned CBT, and they maybe know a little bit about what it is, but I wanted to take this time to really explain what CBT is, and if anybody out there is suffering from anxiety or depression, then I highly recommend cognitive behavioral therapy. It's been around since the 1960s. It's the most effective, most researched type of therapy out there, and it always tends to come out on top when it's compared to other types of therapy or even medication most of the time. So what is cognitive behavioral therapy? Let's think of those two words for a minute. Cognitive, that's just a fancy word for thoughts or thinking, and behaviors are either activities that you're engaged in or certain behaviors that you do when you're having a certain emotion. So let's think of it this way. This is a underpinning, a basic tenet of cognitive behavioral therapy. The idea that we have three parts of our personality, or our psyche, or basically what makes us tick. We've got our thoughts, our beliefs. This could be opinions that we have. They could be deeply held philosophies, values. What does it mean to be a good person? What does it mean to be a good parent? Political beliefs, religious beliefs, that all fits into this category of what helps make us who we are and how we respond to situations. Then we've got the emotions, the mood, the feelings. Those are all pretty synonymous. Happy, sad, depressed, excited, shocked, embarrassed, guilty. All of these are different emotions, and that also helps make up who we are or how we respond in given situations. Then the third category refers to behaviors or actions. Now these could be deliberate activities. You go for a run, or you're going to ride your bike, or you're playing softball, or you call somebody to have a chat. Those are all considered behaviors, but they can also be responses to events like crying, slamming the door, shouting. So it's kind of a broad category, this observable behaviors. Now if you think about for a minute, where does emotion come from? What makes a person anxious? What makes a person sad? What makes a person feel guilty? And a lot of times the person, when you ask them this, they will tell you, when somebody's mean to me, or when somebody says something, when my kids don't come home on time, that makes me anxious. They'll refer to some type of situation. Cognitive behavior therapy says that that's not entirely true. It's not the event or the situation that causes the emotion. It's your thoughts and ideas about that event that causes the emotion. So the situation may trigger a set of beliefs or ideas or thoughts in your mind, and then those thoughts and beliefs translate to an emotion. Or it could go the other way. If you're feeling anxious, it could affect your thoughts. It could make you overpredict the likelihood of something negative happening. It might make you feel that you're to blame, even though most people would agree that that doesn't make sense, that you're the one to blame and that you should feel guilty about this. So our emotions tend to shape our behaviors. It causes us to view things in a certain way. So you have this back and forth where the thoughts are affecting your emotions and the emotions are affecting how you're thinking. And then, of course, the behaviors are also related to these two things. So the way you act is largely dependent on what you think about the situation you're in and the emotion that you're having. And the reverse is also true. If you behave in a certain way or you engage in certain behaviors, then that will affect your emotions and the way you think about things. So when you look at cognitive behavioral therapy, you're trying to figure out what thoughts and beliefs you have and what behaviors you engage in that are contributing to this emotion. And you're trying to learn new ways of looking at things and thinking about things, and also learning new behaviors that are more adaptive, that will help solve problems or help you engage in tasks that are known to improve your mood. So that is a very brief, basic explanation of what cognitive behavioral therapy is founded upon. In other videos, we're going to delve deeper into how specifically to use this general concept to actually beat depression or anxiety. So make sure you click subscribe so that you'll be notified for other videos, and also click like if you like this, and leave a comment in the comments section below if you've had any experience with CBT. Until then, this is Dr. Greenaway signing off, and remember, psychology works.